Hello, I'm ready. Hi, I'm Kate. I'm Kate Beckett, a researcher and nurse from Bristol. So my presentation is all about using forum theatre to improve NHS trauma care. It's based on a project I led called the Enhancing Post-Injury Psychological Intervention and Care, or EPIC study, which was a collaboration between NHS patients, practitioners and researchers, and with Cardboard Citizens, forum theatre practitioners. So my passion. My career in healthcare spanned more than 40 years. Working with diverse stakeholders to improve patient care is my passion. But the NHS is a very complex, resource-constrained ecosystem with multiple conflicting realities, challenges and priorities. But what I think we often forget is it's also full of creative, passionate people and potential change agents. So the issue, in the UK, we spend around £8 billion annually on health research, yet most has little direct impact on patient care. So research seeks to establish generalisable facts by controlling for extraneous factors. Most research evidence is generated outside the NHS and is disseminated through guidelines, reports and papers. The expectation is that this will spontaneously be absorbed into practice in a linear fashion. However, clinical decisions require diverse forms of knowledge or mind lines containing tacit, experiential and research evidence. Mind lines equip practitioners with the knowledge required to meet the NHS's very complex, conflicting demands. Mind lines are generally socially transmitted between practitioners, often using stories or anecdotes, and they're actively moulded to the specific context in which they're used. So the EPIC study developed and tested a new method for mobilising knowledge about the impact of psychological disorders such as PTSD on recovery from injury. Our approach, using forum theatre, sought to replicate or even enhance MindLine's diverse content and the way in which they're effectively transmitted. So the first step was to capture patient, practitioner and research evidence about the psychological impact of injury using multiple interviews, focus groups and a literature review. Then we combined these three strands of evidence and mapped how they differed in ways that are important for patients' psychological outcomes, and collaborated with Cardboard Citizens, theatre practitioners, to convey this data in a play called Altered States, which told a blended patient story with unsatisfactory outcomes from just before to 12 months after an accident, with practitioner and research evidence woven in. In step two, we invited representatives of the same three stakeholder groups to attend one of two forum theatre workshops where they watched the play, shared their knowledge, actively tested ideas and collectively identified recommendations. In step three, we used a framework called the Social Impact Framework to analyse study outcome data and capture what changed, how and why. Our analysis showed that EPIC's approach had a marked impact on contributing individuals and groups, for example, by enhancing their confidence in their own knowledge and its legitimacy and utility, mutual understanding and empathy for each other's lived experience. It also showed how these cognitive, attitudinal, and relational impacts led to multi-level changes in behaviour, practice, and in research, and had wider implications for how we mobilise knowledge and utilise research to improve patient care. We discerned four key mechanisms, those drawn from MindLines and forum theatre, that gave rise to these impacts. These were conveying diverse knowledge, social interaction between different stakeholders, storytelling and drama, opportunities to co-create solutions. EPIC shows that stories and drama have the essential ingredients for catalysing change in complex ecosystems such as the NHS. They can bring research evidence to life, stimulate rational and emotional processing, both necessary to catalyse change, promote mutual understanding, empathy and shared responsibility for health and the NHS. They can reveal tensions between different stakeholders' needs, priorities and NHS resources. They're memorable and relatable to real life and practice. They empower individuals and groups to become change agents and can convey the humanity and complexity of healthcare and use that as its tool. So current significance. It was interesting to think about this. Globally, human societies are facing hugely complex and significant challenges. Many of the structures we depend on to navigate and address these issues just don't work. So we need more grassroots and creative solutions that empower a wider citizenry and engage their diverse knowledge and skills. Just about finished, please do contact me if you'd like to know more, but for now I'm going to leave the last word to Augusto Boal.